Hey guys, what I'm going to share with you today is how to find out if you have poor posture or not. You may be suffering from neck pain, back pain, disc bulge, disc herniation, but what you may not be aware is the fact that poor posture is the cause of all of these problems. So even before you try to fix your neck or back pain, you got to fix your poor posture. So what next? You got to find out if you have poor posture or not, and how bad is your poor posture. So that's why I'm going to share 5 tests that you can do right at home to find out if you have poor posture or not. Let's find out. The first test is to find out if the 5 checkpoints of our body are in one straight line. These 5 checkpoints are the ear, tip of the shoulder, the elbow joint, hip joint, and the knee joint. If these 5 checkpoints are in one straight line, this simply means you have a good posture. There may be a little bit of distortion, which is acceptable. Otherwise, when these 5 checkpoints are in one straight line, this simply means you have a good posture. Now take a look at this image. One can easily understand that this is a slouch posture. The 5 checkpoints that we earlier discussed are not in one straight line in this particular image. Take a look at this. The ear, and then we have the shoulder, which is not in that straight line. And then we have the elbow joint, which is also not in that straight line. Then we have the hip joint and the knee joint, which are again not in that straight line. That's simply because the body is slouched forward, and that has caused the issue. So 90% of us do have this, what is called as the rounded shoulder and forward head posture. The reason is most of our work that we do on a daily basis are all in the front, and we do have very less activities that we do on our back, which simply means the back muscles of our body are left unused and they become so weak, and the muscles of the front, typically the chest muscles, become weak, and this leads to neck pain, back pain, disc bulge, disc herniation, and a lot of these problems. So the point that I'm trying to make here is this: if you really want to reverse all of these issues, then it is very, very important that you work on your posture correction and develop a good posture. The second test what we are going to see is called the thumb test. This test is done by viewing the front side of our body. You may just click an image like what you're seeing here, or you could ask a family member or a friend to evaluate you, but basically by just viewing the front side of our body. Why this test is called as a thumb test is simply because when your posture is right, your thumb is just going to face forward, just like what you see here, and not internally rotated or pointing out to some other direction. It's specifically going to point forward. Just by viewing this image, I'm sure you understood that this is a poor posture simply because the shoulders are rounded forward. But this is a thumb test, right? So we need to find out what is it about the thumb and how we can find out that this is a poor posture. So unlike the previous image, what we see here is the thumb is not pointing forward, but instead it is rotated towards the inside, facing each other. Both the thumbs are facing each other, and this is a typical sign that you have a rounded shoulder. Only when you have a rounded shoulder, your thumb turns inside, and this is a clear indication, clear sign that this is a poor posture. The next test what we are going to see is called the hump test. Even with this image, you can clearly understand there's a poor posture, but I want you to clearly focus on the hump around the neck. The hump that you see over here is not actually any disease or a tumor, but it's a normal bone of the neck. It's called as the C7 bone. The reason why this bone looks like this is simply because, as you see in this image, the neck and the head have gone forward. Typically there's a forward head posture, as a result of which you can clearly see the C7 bone, and in order to protect this bone, the body has deposited a bit of fat over there and it looks like a hump. So if you have a hump like this, or if you come across friends who have a hump like this is again a clear indication that you have a poor posture of your neck. The next test is called the floor angel test. In order to do this test, you just have to lie down completely flat, and then as shown in this video, you just have to take your arms all the way up and just keep it completely flat. While you're just doing this test, you just have to watch out for 2 or 3 important things. The first thing is to see if you can really keep your hands completely flat like this. For some of us, your hand could just remain like this without being able to keep it flat like what I just showed. If this is the case, you have a poor posture, but actually it should just remain flat. And the next thing to notice is your rib cage could just go up when you just try to keep your hands flat. Even that is an indication that you have a poor posture. So with your hands flat, and again your head should remain flat as well. For some of us, it could just pop up like this without being able to keep it completely flat. So the point is, your hands, your head, your back, everything should just remain completely flat, and your rib cage or your head or hand should not just come up, and that's a clear indication that you have a poor posture as well. The next test is the wall angel test. To perform this test, you're going to keep your feet 6 inches away from the wall, and then your buttock, your lower back, your mid back, and then your upper back should all be resting on the wall, keeping them completely flat. And then your head should also be resting on the wall, just like what you see here. And this is exactly what we did even on a floor angel test. We were just resting our head, our upper back, our mid back, and the buttock down there. And then you're going to lift your hands up to a level like this. And if you have a poor posture, you may just notice your back just coming off the wall, which is a clear indication you have a poor posture. Ideally, it should just remain flat like this. And then you're going to take your hands back towards the wall. And if you can just maintain your head, your upper back, and your back completely flat on the wall, even after taking your hand to the wall, then it simply means you have a very good posture. But if you have a poor posture, either your hand may not reach the wall, or your head may just not reach the wall, or your back may just stay away from the wall. So any one of these things is a clear sign that you have a poor posture. Like what you see here now, sometimes your head could just remain like that, or you may just try hard to reach the wall, and you may just look up the ceiling and try to reach the wall, which is again a sign of poor posture. So I'm sure now you understand how you can test your posture using wall angel test. So guys, I'm well aware most of you do suffer from neck or back pain for years, and I'm also aware that you have tried wide range of things to fix your problem, yet the pain remains the same. The answer to your problem could be posture correction. I can't wait to know of your posture test results, so do share your test results in the comment section below, and let's have a discussion. In the next video, I'm going to share some exercises that you can do to fix your poor posture. So stay tuned. This is Gerald Abraham from Be Your Own Doctor.